Wouldn't it be so easy if we just could cut and paste another industry's idea or solution into healthcare and have it take off? It would be so great. And that's often what we're encouraged to do. But I'm here to talk today on this reflection about some of the challenges and the reasons why it's not always easy or straightforward to do it. You can learn from other industries and you can apply some of those things to healthcare, but oftentimes it's just not a one-to-one comparison. And there's important reasons to think about that. Hi, I'm Bruce Spurlock. I'm a physician and healthcare leader committed to helping professionals and decision makers navigate change with clarity. Here at Viral Healthcare, we examine the ideas that are spreading throughout healthcare, what works, what doesn't, and what will it take to make them implement sustainably. Today I'm going to talk about cross-industry learning and some of the reasons why it's really important. This was the main thrust of our podcast this week, and this reflection just highlights a couple of the points that we made on that much longer discussion about what's going on. First of all, there's this emotional appeal because it always feels like healthcare is behind. It's a dinosaur industry. We're always slow to adopt things. I think some of that is because we've been burned so often, and also because we're so sort of invasive and technologically advanced in so many ways with so many devices, so many new medications, so many new changes on a regular basis that sort of the bigger structural ones kind of give us pause to be able to do that because we've seen them not work so often. But there are some fundamental things about why healthcare really is not like other industries. And it'd be great to borrow extensively from them, but we can't. I talked about how in those industries, many industries, it's very easy to wrap and increase capacity with staff and personnel. In healthcare, we can do it on the margins, but when you think about the pipeline to bring in large quantities of new people with education, licensing, regulation, all the training that goes on with that, it's years before we can actually change things rapidly. And Amazon, they can do it out during the holiday period very, very rapidly, where they can hire new staff and then lay them off in New Year, just after the holiday season. So we don't have some of those same capabilities, but it's more important to think about sort of deeper down reasons why healthcare is different. And part of it is because we don't have this unified customer. We have a lot of customers in healthcare. I mean, a lot of them. So patients, we think they're our customer. They're the most important customer, but they're not the only customer because patients are often attached to physicians. So physicians are customers. And if we don't have the physicians working for us, they're going to take those patients to other organizations. And when they're not in the hospital or they're not in the clinic, they're members. So that means the health plans are customers. And while they might have the patient as the key part of it, they also have to contract with hospitals and other providers to be able to do that. And then the regulators are customers. So we don't have a unified customer. And oftentimes, almost always, the incentives and the needs and the professional desires for these different components and stakeholders are not the same. That makes translation of the ideas that happen in other places not so great. We've done a few things well. We've taken a couple of checklists out of aviation and put them into this operating room and the surgical safety checklist. We've talked about how hospital flow and how open access or 24-hour access or instant access in the ambulatory setting is a lot like lean or industrial engineering concepts that other industry uses. But there's probably more that makes us really pause when we think about some of the lessons that are going on because they don't have some of those things. A big important difference in healthcare is that the production decision is made at the individual level. It's not made at the corporate level. I mean, what happens on each patient happens between a physician and the doctor, or a team and the patient, or a team and the family, a small group that are making individual production decisions about what decision to go next. It's not like airlines where the big decision is, do we arrive on time and do we arrive safely? And this one, it's personalized. And I think we like that about healthcare. So there are components about healthcare we definitely want to keep that create burdens. Now, I don't think this misaligned incentives, this non-unified customer is in the end a really good thing, but it is our reality. It's not going to change in the near time future. So when you're thinking about translating from another industry, you really have to think, are there specific structures or specific mechanisms that are dealing with specific structures that are very similar, like a checklist? Boy, The operating room, yeah, we can launch every procedure with the same steps time and time again because there's not a lot of variation between it. But the choice of the procedure, the choice to proceed with a procedure or not is really made at that production decision is made at the individual level between the family, patient, and the provider that's giving them those services. Are our problems structural or the operational nature? I think that's the most important thing to think about. So here's the take-home message. If you're looking at another industry or if you're seeing a solution that's been promoted outside of healthcare, pause. Look around, see if others have used it or see if there's components of it that match it so that their constraints are your constraints. Their context for this solution is the same as your context. Oftentimes it won't be, but there may be ways to take pieces of it or to adapt it. And if it's easily adaptable, then great, knock yourself out. But otherwise, pause and think a lot about whether learning from other industries is really exactly what we should be doing in healthcare. Now, I'm Bruce Spurlock. I'm really excited about this series, and I look forward to seeing you next time. And the next time, we're going to talk about systematic ways to approach problem solving and decision making. And with that, I'll see you next time.